Hey guys, so back doing another video on an update on my hemorrhoidectomy surgery. This is my second surgery I've had in 7.5 months, and so just wanted to do an update in regards to that. I did post a video yesterday which I had to remove because I noticed I had my doctor's cell phone number on there, so that's the reason for removing the video yesterday. I didn't want to put that information out there. That's his private information. So, anyways, I thought I'd redo the video. Um, I'm currently 5 days post-op from hemorrhoidectomy surgery number 2. Again, this is my second one in 7.5 months to address internal advanced hemorrhoids as well as one small external hemorrhoid. The first 2 days was not that bad, um, where I didn't feel hardly any pain because of the medication they had given me at that time, which that medication usually lasts about 24 to 48 hours, and it basically is injected at the surgery site uh, to help give you that relief while you begin the healing process. I was prescribed Oxy again as my pain medication, a 5 day supply to be taken 3 times a day, as well as stool softeners, which you should have been taking already and should be taking afterwards. Dolcosat sodium 100 milligrams is what I take and what my doctor has prescribed me. If you do not have a prescription for the stool softener, you can get them over the counter as well. Okay. So just wanted to go over a couple things. Again, one of your best friends is going to be this guy right here, your bidet. This is a travel bidet. I got it on Amazon.com for $9.99. I am not affiliated with anybody. I am not representing any Amazon or any companies. Anything I talk about here on this video is strictly from my own testimony in regards to my own situation. I am not a doctor, full disclosure. I am not a doctor. If your doctor tells you to do something or tells you to take something, listen to your doctor, okay? This should not supersede doctor's orders or take the place of visiting a doctor in order to address your issues. This is just my testimony of my own situation and what things I learned along the way through trial and error that may or may not help you, okay? But definitely listen to your doctor and follow whatever he recommends, as everybody is different and reacts to things differently. Okay. That being said, as I stated, I had the travel bidet. That is going to be your best friend. You want to make sure to have one of those. If you don't have one, I strongly suggest getting one. It will make things so much easier. You should be taking at least a minimum of 2 sitz baths a day, if not more. Every time you have a bowel movement, you should be doing a sitz bath immediately following. And a sitz bath could consist of either one that goes on top of the toilet, or if you have a large enough bathtub like I do, I have a Roman bathtub, 80 gallon, that I can actually do my sitz bath in my bathtub, and that's what I prefer to do. But you should be taking at least 2 sitz baths a day, and one after each bowel movement. And then you want to soak in a sitz bath for about 20 minutes or so in about waist high water, and it should be warm to hot water. It should not be cold and should not be really hot where you're going to burn yourself, but it should be warm to hot. Okay. Other things that will help you is aside from the medications prescribed, you don't want to stay on Oxy for a long period of time. As soon as you feel like you're able to and capable of weaning yourself off of it, if you don't need to take it the whole time, I would suggest doing so because it is a strong medication and you don't want to become addicted to it. And one way you can wean yourself off is by using either Tylenol or Advil. And what I do is I actually switch back and forth between them when I stop the Oxy. So I would take one pill maybe once every 4 hours, switching back and forth between the Advil and the Tylenol to try to deal with the pain as well as avoid having to take the Oxy if it's not needed. Okay. If After surgery, you definitely should be having your first bowel movement within 24 to 48 hours. Okay, there's going to be packing that they put back there that will need to come out. Where I don't know if you're able to pull it out. Most people poop it out, and that's how I did it. If you're finding that after 24 to 48 hours you still have not had a bowel movement, then you're going to want to get something like this, which is milk of magnesium. And you'll take 30 milligrams of this for an adult, and within 45 minutes to an hour, you should be able to produce your first bowel movement. And then the packing should come out as you have your bowel movement, and then let the fun begin. Okay. Another thing I have is one of these oxygen meter things that read your oxygen level and heart rate. This is good to have just to monitor yourself, as well as a digital thermometer to be able to monitor your temperature to make sure that you do not get a fever or anything like that, that you're able to keep track of stuff. My wife also made me something like this, which is like a pain log, just to kind of log my pain levels and what I'm feeling and when I'm using the restroom and any of that kind of information that may be helpful in the future that I could refer back to, or if my doctor asks questions, I'll be able to refer back to this, as well as like a medication chart that'll log down basically what medication you're taking, the dosage, how often you're taking it, the time of day you're taking it with the date, as well as at the end I would log down what my current temperature is, as well as my heart rate. Okay, so that's a good thing to have as well. Another thing you're going to need is some of these bad boys. So these are some gauze pads. This one is a little different than the one I got the last time. It is the same brand, the Band-Aid brand, which is what I prefer. That's my preference. Again, no affiliation with Johnson & Johnson or any of these companies that I'm talking about this stuff with. But these are the non-stick ones. So these are really good. So this way, as you put it back there and you have to change them out whenever you have a bowel movement or take a shower or what have you, that you can take them out easily without it sticking to the wound, which can cause more pain or discomfort. So that's a good thing to have as well. Lastly, I have this guy here, which is a donut, but it's like the memory foam one. As you can see, there is the cutout for the tailbone support. I got this on Amazon as well. For about $20 to $25, I think it was, that I paid for that. You can take off the cover to it. It is machine washable. It is very comfortable, great additional tool to have alongside with the bidet to be able to help give you comfort whether you're sitting on the couch. If you have to go somewhere in a vehicle and the roads are bumpy, that'll just give you a little more cushion and support from the bounciness of the road to alleviate any kind of possible pain or discomfort. Okay. Some of the things I noticed along the way that helped me is that when going to the restroom to have a bowel movement, I always take a cold bottle of water with me and sip that or drink that as I'm going to help keep myself hydrated, to make it easier to have my bowel movement, and to prevent constipation. As you know, constipation draws moisture out of the stool, which makes your stool hard and could be hard to pass, and can also cause anal fissures, which you definitely don't want that either. Okay, so you definitely want to stay hydrated while going to the restroom, and sipping on that. That'll definitely be a help to help get you through using the restroom and stuff. What else? Also, you may experience cramping or spasms in the rectal area where you had surgery. Now, these spasms can come on randomly out of the blue with no warning whatsoever, and when they come on, they do come on kind of strong. It can last anywhere from a few seconds up to maybe 15 minutes. It just depends, and they are very uncomfortable, and you will not like them, but unfortunately there's really not much you can do about it. The only thing I learned through trial and error that helped me is when I would feel those spasms coming on, I would try to urinate. So I found that that actually helped either alleviate some of the symptoms of the spasm to ease them up or make them go away altogether at the time. So if you're having any of those type of spasms in the surgery area, you can try to use the restroom and try to urinate. If you can't, maybe turn on a faucet to help you go, or drink some water, whatever it is that you need to do to try to get yourself to go. I would not force it. Okay, so don't force it. You don't want to do that. If you have to be patient and stand in front of the toilet bowl for a few minutes until you're able to go, by all means, go ahead and do so. But don't force it, and you'll find that after you're able to urinate, you may feel some relief, either starting to ease up or it may go away altogether. And that's one thing that I discovered through trial and error with going through these surgeries that has helped me. Okay, you definitely want to stay on a high fiber diet. Stay away from greasy foods. No smoking cigarettes. No hard drugs. Anything like that you don't want to do. It will create havoc for your healing process and will make things uncomfortable. Okay, so definitely eat high fiber foods, fruits, vegetables, maybe some soups, high fiber breads. I would stay away from the seedy stuff, at least for the first few days, because you don't want to have to try to pass that through your bowels, and that can maybe be a problem. But definitely stay on a high fiber diet, stay very, very hydrated, drink lots and lots and lots, and I'll say it again, lots of water. Okay? Water, clear liquids, apple juice, coffee with no cream or sugar or anything, just black coffee, green tea, anything that's a clear liquid like that. No alcohol, none of that stuff, okay? But water will be the best option, okay? And you should be drinking about 5 to 6 bottled waters, if not more, a day, okay, to try to stay hydrated. And you definitely want to do that. That will help you through the healing process and as you're going through this, okay? As far as foods, you could eat pears, strawberries, bananas, blueberries, raspberries, what else? Apples. Those are all great high fiber foods. Vegetables, broccoli, sweet potatoes, candy yam, carrots, any of those type of things are also good to eat. And then, like I said, as far as the breads and stuff, just stay away from the real seedy type stuff. It shouldn't be seedy, at least not at the beginning. Okay, so stay on a high fiber diet. That's important. You could also eat as snacks, maybe like, I don't know, Jello or applesauce or anything light and that's going to be easy on your stomach. Okay, so those are some things that you want to take and do to help with the healing process. It is going to take some time to get through this. It is inconvenient. Anybody who's gone through this surgery, who's about to go through this surgery, will understand as they're going through it. But it has to be done, and you want to give yourself the best opportunity for healing and recovery as possible with as minimal pain as possible. Now, my first 3 days were not too bad. That first medicine they gave me was pretty strong, that they put in an injection site, that I didn't feel any kind of pain or discomfort like the first 2 to 3 days. Yesterday was probably one of the worst days, which was day 4, and this morning has been rough as well. So I'm on day 5 today. And the hardest part is, when you're trying to have those bowel movements, and it's you're scared because you know what kind of pain you're gonna feel and you felt it, and so you tend to clench or brace yourself, and that's normal. But definitely by drinking the water, by staying on the high fiber diet, and doing everything you can to keep yourself out of discomfort will help. And following some of these things that I'm suggesting may be helpful to you. Again, I am not a doctor. If your doctor suggests something or prescribes a medication, take it. These are just some additional steps that may help bring you some relief, but these are things that I'm personally doing for myself that I know works for me, from what I've gone through in the past and what I'm currently going through. So, again, I am not a doctor. Listen to your doctor's orders. But these other things I'm suggesting may be helpful to you. All right. Um, Again, I'm on day 5. The first 10 days are probably going to be your worst. When I had the last surgery for hemorrhoidectomy back in December 2020, my pain was pretty much from day 3 through day 9 were my worst days. So I'm on day 5 right now. So I'm anticipating another maybe 4 days or so of some discomfort and pain that I'll be going through as my body is trying to heal itself and as I'm going through the healing process. Um, I do want to say, if you have any questions, comments, or concerns, you can go ahead and post them below. Hit the like button, hit the subscribe button, hit the notification button. If you have a question, I will try to answer it to the best of my ability. If I cannot answer it, I will not attempt to answer it, and I would suggest you ask your doctor. Again, I am not a doctor, so these things are just tips and tricks that may help you, okay? But also, I would encourage you to go back and watch my previous videos if you haven't already, because they're going to give you a timeline as well as how things progressed through the last surgeries, and they may answer your questions as well. Or if you read in the comments from previous people who have asked questions, your question may be answered in there. This way I don't have to be too repetitive on each video. I'm not going to do a bunch of these videos on this, just because I think I've done more than sufficient enough the last time I had the surgeries. But I will maybe throw out 1 or 2 more after this, just to give a timeline of my progress, of how I'm healing and how things are going. But I'm not going to have these videos as many as the last one. I'm going to space these out a lot more in the timeline. So this way I can give some good accurate information as to how I'm healing, things I've gone through, things that I may or may not notice. But again, I feel like everything that you need to know has already been posted in previous videos, that you can go through the timeline to get an idea of what to expect. So with that, again, I would encourage you to go back and watch some of my previous videos, and your questions may be answered there or within the comment section, okay? But again, if you don't find it there, or your question is not answered, by all means, go ahead and just post the question or comment below, and I will do my best to try to answer it to the best of my ability. But again, if I cannot answer it, I am not going to try. Or if I feel like it's a better question for your doctor, then I would suggest that you reach out to your doctor, okay? Another thing that will be helpful to you as well, if you're in the pre-surgery stage, that meaning you have not had the surgery yet, your 2 best friends are going to be that bidet I showed you, which is this. And again, if you have not had the surgery, or you had the surgery and you don't have that, you need to get that. That should be like number 1 on your list, okay? The second thing that will also help you, that I found helped with my comfort before surgery, was the sitz baths. Okay, so that, along with the sitz baths, are going to be your best friend, as well as an ice pack. Ice pack also gave me some comfort, the cooling sensation back there, because you may have burning, or you may have pain or discomfort. So the ice pack, sitz baths, and that bidet, those 3 things right there are going to be very, very helpful to you, okay? After surgery, it's going to be those same 3 things, maybe not the ice pack, but definitely the bidet, definitely the sitz baths, and then that memory foam cushion I showed you in the beginning of this video. You're going to want to get one of those as well, okay? That'll help. The other type that are the blow-up type, they're okay. Something is better than nothing, but sometimes with those blow-up ones, depending on how much you weigh or your size, they may or not be able to give you the support you need if it doesn't hold the air, or it flattens or leaks air, or if you just happen to get a hole in it randomly. That does happen. At that point, it's not going to be useful to you anymore. So I like the memory foam one better because it compresses and then opens up again, and I'll never have to worry about it popping. It is machine washable, the cover, so I can wash it if it, God forbid, got a stain or anything like that. Again, you're going to want to use the gauze every time you have a bowel movement, after getting out of a shower, or if it's just dirty and you just need to change it, you're definitely going to want to use the gauze to help you with that. Okay? What else? What else? That's pretty much it, I think. I know there was one other thing I was going to mention, and now I can't think of it. But again, stay away from smoking. Stay away from spicy foods. You don't want to introduce that into your body because you're going to have to poop that out, and it may be painful and hurt. Also, when you're taking your sitz baths or you take a shower, do not let soap get back there. It will hurt. It will sting. You will regret it. Just wash the front side, your legs, and that's about it. Okay. What else? What else? Yeah, I think that's pretty much it in this video. Again, these surgeries are not fun. I totally get that, and anybody going through this or who has gone through this will fully understand. I've heard women refer to it as being worse than pregnancy. That'll just kind of give you an idea. I have a very high pain tolerance, so I can handle a lot, but even me, especially when having the bowel movements, I thought I was going to cry. It was just that uncomfortable and that painful, and you have to brace yourself, okay? If you have a step stool, like a wooden step stool when you're trying to have a bowel movement that you can place your feet on, that's another thing they suggest that may be helpful for you. I don't personally use it, but it is another thing that'll help you to be able to pass your stool easier, okay? But definitely stay hydrated, stay away from smoking, stay away from greasy, spicy foods, don't drink any alcohol, don't do any drugs. If you're a 420 smoker, I would even stay away from that for a little bit because if you cough, you're going to feel it. Now, if you're using one of those tinctures, I think they call it, or a vape, you may or may not be able to get away with that. But I would kind of hold off as long as you could before trying to do that again. Now, if you're trying to wean yourself off of the oxy because you feel like you don't really need to take it anymore, but you're still just having a little bit of pain, then participating in 420 may be helpful to you to wean you off of the oxy, okay, if you're already a 420 smoker, okay? But definitely take care of yourself. Stay fully hydrated. Drink plenty of water. Eat that high fiber diet, and follow some of these things in the video that I've mentioned because this is what it's going to take to just get through it and go through the process, okay? With that, I'm not going to drag this video out any further. If you have any questions, like I said, you can post them below. I would encourage you to go back and watch my previous videos that I've done on the hemorrhoidectomy surgery or the anal fissure surgery if you haven't watched them already. And also check out the comments because your questions may already be answered in those videos or in the comment section. But if you do not see it or have another question, by all means, feel free to post it below. And if I can answer it, I will. And if I can't, then I will refer you to your doctor and not even attempt to. And with that, I will see you guys in the next video. Thanks for tuning in. God bless, and we'll see you next time. Take care.